Well, as we tend to on a Friday morning, we hear from the Health Minister giving us an update on COVID-19. This morning, the Health Minister, Joe Phaahla, saying stakeholders are discussing whether to make vaccinations compulsory or not. He says it's a suggestion government is looking at. And let's listen to exactly what he said.
There's been suggestions which have been made by a number of influential people that we should consider a mandatory a vaccination policy. This is a matter which we are very reluctant to venture into, but it's a matter which we are discussing at various forums to see whether this is an option. At this stage, it's just a suggestion which we are looking at.
Yeah, I mean, it really is a major talking point. We're seeing around the world certain governments are making mandatory vaccines an issue. We know, of course, that the jabs break the link between infections and deaths almost completely. So from a public health perspective, it makes a lot of sense. From an economic recovery, it makes a lot of sense. But many not comfortable with government essentially having the power to determine their health choices. Even government itself, as you can see, is quite reluctant on this issue, even as it is a point of discussion. Well, I'm joined now by Professor Alex van der Heever, specialist in health economics and finance at the Wits School of Governance, to discuss this now. Professor, what is your view? Do you think that COVID vaccines should be made mandatory?
I think that we're not yet at the point at which that is the sort of the critical decision to make. Sometimes making things mandatory doesn't necessarily result in a capability to enforce the mandate. So you've got to be clear about what your objectives are at what point. So at this stage, we're vaccinating around about 285,000 people a day, which is a fairly good rate, and we need to get that up. So the first issue, the first bridge to cross, is to vaccinate the willing. And during the process of vaccinating the willing, you want to deal with the reasons why people are not coming forward and address them substantively, because in many cases, these are irrational positions driven by conspiracy theories on the internet, and they can be confronted. But so I think that, so before we get to the implementation of mandates, you try and do everything possible to get the sort of voluntary vaccination program to work.
And my understanding from the recent HSRC survey is that vaccine hesitancy, yes, it's an issue, but it's not as big as the challenge of access, and that's the real reason we're not getting enough people to get their jabs. And as the point you make anyway is that it does seem to be picking up again.
So it's picked up because we've reduced the age categories for obtaining vaccinations, which means that in the urban areas we will have a very big improvement in coming forward. Now, Johnson & Johnson was designated for the sort of more rural areas where the cold chain issues would prevent Pfizer from being effectively and efficiently distributed. And that hasn't necessarily, the pipeline for Pfizer hasn't been as prolific as for Pfizer. So so that's one of the issues, is really to get to the rural areas. It's also to get to the people who don't quite understand it. So the issue of vaccinating people at sites of where social grants are being provided, etc., can be very important, bringing the vaccination process closer to people. So I would argue that it is correct to think that we should deal with, first of all, the willing, deal with the people who face structural barriers to accessing, and if necessary, you start to then deal with the problem of the people who don't want to come forward, and you might be able to address a part of that with dealing with the messaging, and then you get to the point where you worry about whether or not mandates are necessary.
So we're not there yet, as you say, and also government seems quite reluctant at this point as well. Would it be legal to do such a thing?
So I can't give a legal opinion. I think that but I would say that the judgment call on that depends on the public health impact. So in the case of herd immunity strategies, where a vaccine provides essentially provides virus elimination, the public health objective might support a legal mandate. But in a situation where there's continued transmission, whether or not you're vaccinated, the risk now falls on the unvaccinated. And so the public health threat is less from the unvaccinated to the vaccinated, and more from the vaccinated to the unvaccinated. So I think one would have to motivate a legal case based on what kind of public objective you're chasing. So if somebody is making the decision to put their own lives in danger as opposed to others, it might raise different legal questions than somebody who's basically a threat to other people. So at this point in time, it's unclear totally what we're facing. But but for instance, we don't necessarily prohibit somebody from smoking or drinking alcohol, even if it does damage to them.
Yeah. But we do stop people smoking around others to prevent
Absolutely.
those other people. So what would it look like practically if it was mandated, the giving out of vaccines? Would it essentially mean that if you do not want to be vaccinated, you would have to prove why you don't want to be vaccinated and perhaps undergo rigorous testing, for example?
So it's very difficult to understand how a national mandate would be implemented. If an allowance was made for employers to mandate and, for instance, to apply some kind of employment-related penalty for non-compliance, in other words, that you are dismissed, if a framework like that could allow for mandates in particular settings and situations, such as if you're going to enter a sports facility or if you're going to enter the workplace, you need a mandate, need a vaccine. But to actually implement a national mandate requires that you've got to go out and find out who hasn't been vaccinated and pin them down and vaccinate them. I think that's a bit of a tall order. But I think that it is obviously feasible for these more micro mandates to be applied. And what government would be doing if they were applied is to give legal coverage to people who are, or to corporations, businesses, or situations where it appears appropriate. And in those settings, there might in fact be a reasonable public health reason for doing it.
How are we doing with our vaccine rollout? You know, we know it's picked up, but we also heard this morning from the health minister that it looks like November is going to be the fourth wave. And in fact, there's a fear, it seems quite a real fear, that we're not actually going to fully exit the third wave before possibly the fourth wave is upon us, because everything has been disrupted by the Delta variant. So it's hard to predict when that third wave is actually going to end.
Yeah, so we're in an uncertain position at this point. So first of all, we've had continuous transmission irrespective of the waves. And very often waves are driven by sort of specific factors, like people going back to school potentially, people going into settings where they congregate. And that might initiate something. But the riots definitely look as though they had an impact in KwaZulu-Natal. But other areas have experienced continuous high transmission, Northern Cape, Free State, etc., which is unusual. Western Cape going sideways, able to get that sort of very steep downward movement. And the issue is that we've actually reduced restrictions in this period, which means that if there have been super spreading events, it takes longer for it to burn out. So the fourth wave, a fourth kind of peak wave, is difficult to tell where that would occur. In the summer situation, people are able to protect themselves more if they go to restaurants because they can be outside. But so we will basically just have to wait and see. It's very uncertain. The main issue is, despite the waves, which you're seeing internationally, if we've got a vaccinated population, the waves have left less of an impact on hospitals, severe illness and death. And that's basically what we're aiming for. So we might still continue to see waves right into late 2022. But the question is, are they going to be deadly?
Yeah, absolutely. To break that link between infections and the deaths is where we hopefully are headed soon. Thank you so much for your time this evening, Professor Alex van den Heever. He is a specialist in health economics and finance at the Wits School of Governance. Let's